Well, good morning, everyone. Today we're gonna do things a little differently. Up to this point, we've had our devotion times as First Church and 10 o'clock on each day of the week, Monday through Thursday, and then on Friday we've done the little fun pastors in plaid thing. And so we're starting a new series this weekend on out of the book of Proverbs, Wisdom Says. And so we thought it would be a good time to switch it up a little bit. And so I have a guest today. This is Dr. Prudy Barrett, part of our congregation. And I thought it would be good for us, we think about Wisdom Says, so to have some topics. And so every Wednesday we'll have a different topic that's going to help us as we're thinking about wisdom, to find some wisdom on a very practical, in a very practical way. So we're going to talk about, might as well just jump right into it. So we're going to talk about COVID-19 today. So what an exciting topic. So welcome, Dr. Prudy. We're glad that you're with us.
Thank you.
In this first inaugural little session. And so just to set things up, I want to share a couple passages from Proverbs. Proverbs, sorry, I had it all. Oh, here it is. Wrong little book. Proverbs chapter 19, verse 20 says this: "Listen to advice and accept instruction, that you may gain wisdom in the future." So that's some good advice in itself. So we don't have all the information that we need, even though, Dr. Prudy, I have absorbed copious amounts of all kinds of information about COVID-19. I mean, I've read articles, I've watched YouTube videos. I don't know that I would call myself an expert. So that's why you're here. Not that you're the expert on this exact thing, but we're going to talk about your bio in just a second. So wisdom matters. So listen to advice, and so that's what we're gonna do today. We're gonna take what Proverbs says, we're gonna put it in practice. But there's another passage that I think is super important as well to consider, and that's Proverbs 26:12, and it says this: "Do you see a man who is wise in his own eyes? There's more hope for a fool than for him." Let's just chew on that a second.
Yeah.
See a man who's wise in his own eyes. There's more hope for a fool than for him. So I think that, in this age, it's really, there's a lot of people out there that they just, whatever topic you bring up, they're the expert on the subject. And there's a lot of misinformation out there. There's a lot of just crazy theories, whatever. And so it's really important, I think, for us to approach subjects that we are not an expert in with some humility, and to consider the source that we're getting it, where we're getting our information. And so that's why, Dr. Prudy, that's why I thought it'd be fun, instead of me talking, well, let me share all the things I learned as I researched the internet. So Dr. Prudy, could you share, I thought it'd be a good way to get started as we get some advice from a wise source. Share maybe your bio and and kind of your background a little bit.
Sure. Well, I started off with a degree in human nutrition, medical school, and then residency in pediatrics. I was a pediatrician in town for over 25 years.
And we brought our boys to you, and
yes, yeah, I remember some injuries. But I've always been interested in working overseas in third world medicine. So I wanted to prepare myself for being able to transition into that career. I went back to school a few years ago, got a master's in public health at the Medical College of Wisconsin, which used to be Marquette University. Mm-hmm. And then that didn't really seem enough, so I went back to school again to the London School of Hygiene and Tropical Medicine, which is probably the #1 school that international medical people go to. I was working towards a master's in infectious disease, which is 160 credits, I was diagnosed with cancer and had 2 back surgeries, so I had to take a year off. I ended up with the post-grad diploma, so 120 hours instead of 160 hours. It was a big accomplishment, though, and in infectious
Yeah.
disease.
Yeah.
And then I went back to school yet again to the University of Minnesota and was certified in tropical medicine.
So to suffice it all to say, even though I've read a few articles on the subject, you probably are more of the source that we need to go to than me. So I'm going to ask some questions, and we're gonna let you help us kind of
I'll do my best. I won't lie. I won't tell you anything that I don't know.
Sure. But that's impressive, and I know you've served in some places with Ebola and just some really serious, some of these infectious diseases. So you are no stranger to this. It's a related field, certainly. So
True.
yeah. So can you just, because I know there's, people, I've heard people say, well, what's the difference between this and like the common flu, and people, there's not much difference. People, some would say whatever. So what is, can you just very simply explain what is, and what is COVID-19 kind of the official name, and coronavirus is the, or does it matter what we call it? Is it all the same?
Yeah, it's like the strain.
Yeah. So what, just could you like explain to him like a third grader or whatever?
Okay. All right. A third grader.
What is it?
Okay. So there are families of viruses. Influenza is one family, coronavirus is another family of viruses. They're all viruses, but they're different. And so I kind of get a kick out of people comparing it to influenza. Sure, some of the symptoms are the same, but they attack the body in a completely different way, and they have sort of a different immune response, which is really what you're looking for. So I think what's important to know is that for both influenza and coronavirus, there are some strains that only infect animals, and there are some strains that only infect humans, because viruses live to reproduce. They have to get into your body, they have to get into your cell, they have to do what they need to do to make copies of themselves, and then they need to escape. So they need the specific mechanisms to do that, and human cells are different than animal cells. So we develop, as you catch different strains, you develop immunity. And as long as, and viruses mutate to adapt, as long as those adaptations are slow, our immune system can respond. And but when it's really fast, when something huge happens, then our immune system doesn't have any way of knowing how to deal with it. Wow. So that's what happened with when we had H1N1, the swine flu vaccine, and it jumped from pigs to people. It was a big difference, and our immune system was confused. But yet with influenza, the basic backbone of the molecule stays the same. So we still have some partial immunity from flu shots, different flus we've had in the past. This coronavirus, we're starting from scratch. We don't have any immunity to it.
And it really it impacts our respiratory system, which is
yes, and that's true of both families of viruses. They prefer respiratory cells.
Yeah. So what do you think? What makes this so dangerous? Because why is the difference in particular?
Mm-hmm. Well, the human body fights infection in a couple of ways. We have what I call the generic response, which our immune system, they see an invader and, they start throwing sticks and rocks at them. They just try and get rid of it. But then if they recognize what it is, they can send in the specialized equipment, like the antibodies and the special cells. When it's in something new that they've never seen before, they have to our body has to make that stuff. So it's still trying to get rid of it by throwing rocks and sticks and doing everything that it can, while it figures out how to make specialized weapons. The problem is that when it's just the basic, generic weapons that they're doing, there's collateral damage. And that seems to be a big issue with coronavirus or with COVID-19, is that the inflammation, which is the way the body tries to get rid of any infections initially, the inflammation is so bad and it continues so long because it takes a while for us to come up, our bodies to come up with what it needs to specifically fight the infection. So there's a lot of damage done by us.
Your own body is
our own body
that is working
trying.
Yeah.
And I wanted to say something because I never hear this on the news, but your skin actually is your largest immune system. I mean, that's your biggest tool. It prevents infections from entering. And the same for your mucous membranes. And what they never talk about on TV or the radio or you read about is how important mucous membrane health is. I mean, the Lord gave you this wet, sticky stuff to kind of trap germs and viruses so it can't get in. And that's why when, your nose runs because it's, trying to wash it out.
More of that. Yeah.
Right. So if one of the weapons you can use, one of the preventions is to keep those healthy, keep them moist. You want to keep hydrated. You want to keep your humidity up.
Yeah.
You don't want to pick your nose because if you get little abrasions in there, then, it's a perfect place for it. Just like when you get cut, it's more likely to get infected. Same thing with your nose. I mean, infection can get in. So that's, a really important thing. That's where the first battleground against COVID starts.
Yeah. And so your nose would even be, because that goes right into the respiratory system, that would be even more important than your mouth or your eyes.
Yes.
All of any place is good, but your nose.
Right. The nose is the most important thing. And, they talk about, if there's COVID in the food, you have stomach juices and there are other things that also impact. So your nose is really the gateway.
Yeah. So that's a good segue to, okay, we got people listening and you hear all kinds of stuff. What to do, what not to do. What can we do to minimize as best we can the risk when we're out, when we have to be out? Best case scenario is stay home, but when we have to be out. So what's the best practice for us?
Well, I think the best practice is to, as I said, keep yourself as healthy as you can, just in general, specifically your mucous membranes. But you want to avoid sick people. But the problem with COVID is that you are sick before you know you're sick. Yeah. And they're finding more and more evidence that you're shedding virus long before you feel achy or feverish or anything. So you'd never know when you're around somebody that's sick, which is why they're recommending that everyone wear masks.
So but just to be clear, so that's not primarily so that you don't get something. That's so you don't give something when you might even know you have it.
Exactly, because most viral infections, it's as you're getting sicker that you're, more contagious, but that's different with this.
Yeah.
So in fact, there's some evidence we may be the most contagious before we even know that we're sick. Yeah. So so you're wearing a mask not to protect yourself, you're wearing a mask to protect others.
Yeah.
And because COVID is spread by droplets, sneezing, coughing, and even if, some people kind of spray when they talk, including me. So if you get wet, you'll know. But maintaining a distance, 6 feet is what they're saying, so that people, you're not within their breathing space.
Right.
That also will protect. But the idea of the mask is to collect those droplets.
Yeah. So close talking extroverts, this is just the worst thing in the world.
Right. You don't want to invade somebody else's space or have them invade yours.
Sure. Okay. Yeah. And at first they said because that's a little confusing too. Because, and again, you have all these sources, and so you had, hey, you should not wear a mask, then you should wear a mask. So can you just give us a little nugget of maybe why that change and why, as we said, yes, it is good,
Sure.
but maybe why they said that at the beginning.
Well, I think that people need to have a little bit of tolerance for change because it's new. And, so knowledge is evolving. So what they thought was true at the beginning they may find out isn't true as more and more knowledge comes. So I don't think that we need to be disappointed or feel like there's a failure in the system if something changes. But the big difference in regard to the masks is that when you're contagious, and that's just not really typical of most viruses to be contagious ahead of time.
Yeah.
We used to say that about chickenpox, that they were contagious before they broke out, before you knew, but it's just not real common to have that much viral spread, to be shedding viruses all over the place before you're sick.
Yeah.
So that's really the reason for the mask change.
Yeah. Okay. So let's put the cookies on the bottom shelf. Wear a mask. It's if it's a way that you can, if you're out in public, you can help somebody else. As followers of Christ, we probably ought to do whatever we can to be loving and helpful to people. So if you got some issue with wearing a mask or whatever, then stay home. But wear a mask. And no, don't send me an email and don't post in the comments something stupid. So just wear a mask. Not a big deal. Is it that hard? Just wear a mask.
Yeah, and so pretty.
Your personal liberties have not been destroyed if you wear a mask and simply save a life. Yeah. Anyway, so what as you think about all this, and there's all this data out there, and we're trying to figure it out. So what worries you as you look at that?
I really like epidemiology, so I've been sort of a data geek about all this stuff. And really, if I could just sit around and read about it all day, I would be happy. But what frightens me is actually the lack of data.
Yeah.
And it all goes back to the testing thing. We haven't been able to test. If you can't test to know whether or not, if you can't test accurately to know whether or not someone truly has the illness, how can you make projections about how it's going to end up? I mean, you don't have the data to know what's going on or make predictions about what will happen. So I think that's really my big concern, is that we just don't have it. We just still don't know.
Yeah, we don't. Yeah. So what then, on the flip side, what gives you hope as you look at some of what we're hearing now?
Well, from what I've heard, when they have done some of the antibody testing, a lot of people have been immune that weren't aware that they
more
sick.
so
what would be great is if everybody in the U.S. could get tested, and we would find out that 80% of us are immune, and that would be awesome. But even if a lot more people are immune than what we think, we're that much closer to having what we call herd immunity, where people are pretty much protected because the people around them are not going to get sick.
So do you feel like some of what we've been doing, the sheltering in place, the social distancing, the stay 6 feet away, wearing some, do you think that that's been a positive thing? Has that helped to, and we're learning all kinds of new terminology. Maybe you know all this before in your 140 hours of stuff, but there's all kinds of new stuff I'm hearing. But the whole flatten the curve thing, do you feel like that has contributed to that?
Well, I think that it's done a tremendous job. And my fear is that people are using that information to say, see, it wasn't such a big deal after all. Well, you don't know how big of a deal it would be, but you don't have to look very far to look at Spain and Italy and New York City to see that this could really ravage a community.
When it gets away from you.
So I mean,
ability to care for people. Yeah.
I think that we definitely have flattened the curve. We've been able, if nothing else, we've been able to allow the ICUs and the emergency rooms the ability to keep pace. I haven't heard of anyone having to be turned away, even in New York, from a ventilator or anything. But when we stop, I don't see, I mean, we're going to have to find a new normal. If we just go back to how we were, we're in no better shape now, really, than we were 6 weeks ago or whenever all this started. So, I think I'm very glad there are very much smarter minds than mine that are having to figure this out. But there will have to continue to be some mitigating efforts, like maybe we'll have to wear masks for the next 3 months or 4 months or 6 months. I mean, maybe that's just going to be the new thing. I don't know, but there's no reason to believe that we can just open up tomorrow and everything's going to be hunky-dory, because it's not. The second wave could be worse.
Yeah, so we still have to be smart, be wise, from what we talked about at the very beginning. Let's not, what did that passage say? Do you see a man who's wise in his own eyes? There's more hope than for a fool. So we want to listen well. Sources matter. I've been working on a postgraduate degree myself, and the professor keeps just beating the drum. What's your source? Mm-hmm. And popular press articles from some random magazine that somebody's producing down in his basement is probably not a credible source. What's the sources that were, and that's why I thought it was to bring you on.
There's some frightening stuff out there, some very frightening stuff written by people with no credentials. Yeah.
So check the sources is always a good one. So let's just conclude with, I'd love just your heart for the world. You went back. I'm going to ask you what age you were when you went back to school, but you went back to school. You could have just said, you know what, I've done my part. I've served humanity. I've helped a lot of kids and children through my years, but you really had this heart to go around the world. And can you just describe a little bit of what you have done around the world?
Oh my goodness, I've done many things. When I first started out, I was doing mostly just like short-term projects in medically low-resourced areas, just to kind of help people out that didn't have a doctor around. I ran a clinic in Haiti for 1.5 years. I was the medical director. But then as I got a little bolder, I mean, those first trips were really tough when I didn't have a shower. And I mean, I wasn't sure I could handle it. Now, I mean, indoor plumbing is completely optional, even at the hotels we stop at in the States, Tom says.
But you do draw the line when they don't have Diet Coke.
I do. That's a hard one. That is definitely a hard one. But most recent, then I branched into disaster response. It was usually, sometimes it was natural disasters, like I've responded to earthquakes and tsunami, but most often it's, I'm doing work with displaced populations due to war. I've been in a lot of conflict zones.
So the refugee camps, places.
Camp.
People have nowhere to go. There's no access to medical, sometimes food, sanitation. It's just really the worst. Some of the worst.
Yes, yeah. Actually, the worst place was one of my last places, Bangladesh, where they had 500,000 people show up in 4 weeks, and there was nothing there, and so that was horrible. I was one of the first teams in, but and I've never seen anything like that before. But, as I get older, I have more physical limitations. So I'm trying to do more of the supervision now instead of the bending over and looking in 4,000 ears a day in the hot tent in Africa. And I'm doing some consulting for some of the big organizations.
Yeah. So it sounds like you've taken this idea that being a follower of Christ should inform our lives, that as we look around the world, that we should, if we can, like we've had that conversation before, try to make a difference.
There's a lot of needs out there.
Yeah.
A lot of needs, and not just medical. I mean, and we can all do our part somewhere,
Yeah.
even if it's just in our local communities.
Yeah. We'll just, if we listen well, we can see the needs. That's what I always appreciate about you, that it's not just rhetoric, that you've put your career on hold at times and gone at different places in the world. And
Well,
again,
I've had an awesome time.
yes,
It's been fun.
yeah, that's awesome. Well, Prudy, thanks for your time today. It's been super helpful. I hope those that have been listening today have found some help. I know we watch the news, we read stuff, we see stuff on different places on the internet. And so it's just good to be able to hear from someone we know and trust right here in our community that has the bio to back up what he's talking about. So that's that's good. So we don't want me talking about COVID-19 with someone like yourself. So thanks for joining us today.
Thank you.
All right. Well, everyone, thanks for joining us today for what's been a little bit of a different time together. And so I encourage you to come back. Next week, we'll have another guest on Wednesday. So Wisdom Wednesdays through this Proverbs series. And hope you'll join us on the weekend as well. So God bless. We'll talk to you soon.